Exposing the silent struggle in your esophagus, a condition that often goes unnoticed until it significantly impacts daily life. Let's dive into the world of achalasia, a rare but serious disorder that affects the esophagus, the tube that carries food from your mouth to your stomach. Achalasia is a chronic motor disorder where the lower esophageal sphincter, or LES, fails to relax. This sphincter is a critical valve that opens to allow food to pass into the stomach and closes to prevent acid reflux. This results in a functional obstruction at the gastroesophageal junction, making swallowing a real challenge. Imagine trying to push food through a tightly closed door. That's what happens in achalasia. The hallmark of achalasia is the loss of nerve cells in the esophagus, leading to high LES pressure and reduced peristalsis. Peristalsis is the wave-like muscle contractions that move food down the esophagus. Imagine a bird's beak appearance on imaging, classic for this condition. This distinctive shape is due to the narrowing of the lower esophagus. Patients often struggle equally with swallowing liquids and solids, so they eat slowly and drink in small sips. This can make mealtimes long and frustrating. Pain is common, especially if eating or drinking rapidly, and very cold drinks can make symptoms worse. The pain can be sharp and intense, often mistaken for heart-related issues. Repeated swallowing or performing a Valsalva maneuver can sometimes help. The Valsalva maneuver involves holding your breath and straining, which can temporarily ease the obstruction. Regurgitation is another frequent issue, especially with changes in position or physical activity, and can even lead to pulmonary aspiration. This means food or liquid can enter the lungs, causing serious complications. Foul breath may also be a sign of fermenting food stuck in the esophagus. This can be socially embarrassing and distressing for patients. Achalasia can be caused by genetic, autoimmune, infectious, or cancerous mechanisms. Each of these causes can disrupt the normal function of the esophagus in different ways. The loss of smooth muscle cells makes the esophagus highly sensitive to gastrin and cholinergic agents. These substances can exacerbate the symptoms by increasing muscle contractions and pressure. There are different types of achalasia type 1 with absent peristalsis. This means the esophagus does not contract at all, making it very difficult for food to move down. Type 2 with abnormal pressure patterns. In this type, the esophagus shows some contractions, but they are uncoordinated and ineffective. And type 3 with spastic contractions. This type is characterized by intense, painful muscle spasms that can make swallowing extremely difficult. Sometimes tumors at the gastroesophageal junction can mimic achalasia. It's crucial to differentiate between the two for proper treatment. Chagas disease is another cause, particularly in areas endemic to the protozoan infection. This disease, caused by the parasite Trypanosoma cruzi, can lead to severe esophageal damage. This disease can damage the esophagus, heart, and other organs, leading to severe symptoms. Early diagnosis and treatment are essential to manage the condition effectively. Understanding achalasia is crucial for effective management and improving quality of life. Treatment options include medications, pneumatic dilation, and surgical procedures like Heller myotomy. Stay tuned for more medical insights. Knowledge is power, and understanding conditions like achalasia can help you or your loved ones seek the right treatment and improve overall well-being.